So this is where I work. This is the Blama Community Health Center. It's in the Eastern District of Kenema. So if you think about the hospital system in this country, you have the district hospital, the government hospital, and then one level below that would be a community health center. And that's what this is. So it's a larger community health center that is primarily in a rural area outside of the city. So let's go and see the rest of the facility. Right here, you'll have our water pump. We have recently done a grant project. So me and my coworkers work on a grant project to refurbish the water well and put an electric pump in there, and then it will run water up into these water storage tanks and supply the facility with running water. So let's go see where the water goes. This is our labor ward. Midwives and the nurses work in there. There's also bedding. There's places to sleep for women to do overnights so they can have their 24-hour checkups after giving birth. Sister, how are you? So this is the EPI room, also where the midwives will do reporting, ANC visits. EPI is the extended program of immunization. ANC is antenatal care. So we'll do visits in here, free checkups with women during their pregnancies, and we'll also give vaccines in here and dual direct feeding. I spend a lot of time in here. Yeah. Camel. Captain Camel. Coming over here, this is the outpatient ward. This is where most of the action happens. See all the under 5 sick children as well as general patients above 5. That's kind of how things are divided in the CHC is under 5 and above 5 general patients. So come in here. So this is where the magic happens. These are the CHOs, the CHAs, the nurses, so that's community health officer, community health assistant, and we all know what nurses are. So y'all can say hello, don't coucher. Hello. This is kind of like a record-keeping wall of current projects. UNICEF has certain indicators that they look for everywhere between antenatal care, vaccines, under 5 sicknesses, general patients, all that kind of stuff. This is our current quality improvement project mandated by the district health management team in Kenema. We're trying to raise the coverage of the new malaria vaccine that rolled out last year. So we have a couple of different methods of doing that. The main one is going to be vaccine tracing and outreach in the local villages. So that's what all these charts are kind of showing. And then just moving around, you'll see different rooms for seeing patients. You have like the main office for clinical consultations, rooms for doing procedures. We also have a tuberculosis treatment clinic here, as well as an HIV clinic here. So we are pretty well supplied, pretty well staffed. It's a good place to be, good place to work. Keep on moving. This is the red approach. It shows how we're doing on vaccines. We're steadily getting up to the 100% goal of reaching every child in the chiefdom. Things are starting to pick up here in the morning. Around 9 o'clock is when people will start to venture off and make their way to the clinic. These are the nursing quarters and the CHO quarters, so the staff actually live on the grounds of the health center. So they're actually on call 24/7. They don't really get a break, they don't get holidays, nothing. They're hardworking people. People come at all hours of the night, every day, always on call. It's quite a job. That's that.